68-year-old male presented with complaints of nausea, vomiting, and abdominal pain of diffuse cramping type. Patient has been suffering from cough associated with sputum for 2 months. Okay. There's no history of fever, no weight loss. So we are ruling out tuberculosis. No history of TB contact. That is again affirmative. He's a diabetic and hypertensive on metformin and telmisartan respectively. On physical examination, no pallor and dry mucosa is present. Cervical lymphadenopathy. Are we dealing with malignancy or are we dealing with probably sarcoidosis? Vitals are febrile, pulse 99, BP 150, 100, little on the higher side. Auscultation reveals no added sounds. So the lung is clear. Chest X-ray is performed and is shown below. So I can see there are bilateral hilar lymphadenopathy probably, but I do not see any malignancy or anything. His complete blood picture shows anemia, platelets of 1,20,000, leukocytes are 10,000. Serum sodium is 140, which is normal. Potassium is 4.2 normal. Creat is 2.6. There's some AKI. Calcium is 12.9. Calcium is 12.9. Albumin is 4.1, so which indicates that the calcium is truly elevated. There's hypercalcemia, which we're dealing. Phosphorus more or less is on the normal side. Lymph node biopsy shows a non-caseating granuloma. Good. So what are we dealing with? Sarcoidosis. Non-caseating granulomas is one takeaway associated with a hypercalcemia, associated with hilar lymphadenopathy, associated with cervical lymphadenopathy. Tuberculosis is ruled out. Patient is having cough associated with sputum. So likely the symptoms here we are dealing nausea, vomiting, and abdominal pain are more likely because of the increased calcium. So what is he trying to ask us? Identify the cause for the increase in the calcium levels in these patients. So what is the cause for hypercalcemia and sarcoidosis? It is due to the increase in 125 dihydroxyvitamin D. Okay, so that will be our right answer. PTH related peptides, this I would think could be like lung cancer, CA of lung. Here, what would have been helping us in thinking it's a CA of lung? Cervical lymphadenopathy, yes, I agree, but there won't be a hilar lymph nodes in CA of lung, and at the same time, they might give us some history of patient being smoker, etc. So, as we are already discussing symptoms of hypercalcemia, let us once revise: moans, bones, groans, and stones. Correct. Patient will have psychiatric manifestations like depression, lethargy, even psychosis. Bones, because increased calcium resulting in osteoitis, fibrosis cystica. Groans because of abdominal pain, diffuse abdominal pain, constipation, colicky type of pain. Stones because renal stones, and even renal failure can manifest because of the chronic stones, like a obstructive nephropathy. And the serum creat also here might help us in saying that the patient has some amount of renal involvement. Thank you.